right, this is the last acid-base imbalance we're going to talk about. This is metabolic alkalosis. So the lab values associated with metabolic alkalosis are going to be a high pH indicating alkalosis and a high bicarb level. Again, bicarb is our metabolic indicator, and usually a base excess, which is a positive number on that base excess result. Again, we're going to talk about base excess more in its own lesson later on at the end of the course. So the general causes of metabolic alkalosis are the exact opposite of the general causes for metabolic acidosis. It's either caused by a loss of metabolic acids or by an increase in alkalines or bases. Now, that increase in alkaline substances could come from things like excessive use of antacids. There's people that will pop Tums like it's candy, or from the kidneys retaining excess bicarb. Now, the loss of acids could come from any number of conditions, the most common of which being excessive vomiting or NG tube suctioning. So again, our stomach is a big bag of hydrochloric acid. And so if we are going to, forcefully eject all of that out of our stomach, or we're physically going to suck it all out, then we're taking away all of this acid from their system, and the likelihood of them developing a metabolic alkalosis is very high. Now, another possible way that they could lose an excessive amount of acids is through diuretics, specifically through potassium wasting diuretics like furosemide. So here's the thing. Not only can alkalosis cause hypokalemia, but hypokalemia can also cause alkalosis for the same reasons. This is my cell, and this is the bloodstream. If the body sees that there's just not enough hydrogen ions out in the bloodstream, in other words, we're in alkalosis, then it is going to take the hydrogen out of the cell and replace it with my potassium. And so I end up decreasing my amount of potassium in the bloodstream to try to fix this pH situation by bringing more hydrogen out. So it's the same concept, it's just in reverse. So the problem here is it's kind of a chicken or the egg thing. Are we moving the potassium to fix the acid, or are we moving the acid to fix the potassium? So just know that alkalosis and hypokalemia are very, very closely related. Now, the other thing that you may have picked up on here is that acidosis causes vomiting, but vomiting causes metabolic alkalosis. So think about it. It's like a teeter-totter. Okay, if I'm swinging over here to the acid side, then I'm going to start pushing up, vomiting, trying to get rid of my acids, trying to come over here down to the alkaline side. Well, it's very possible that I go past balance and I get all the way over to alkalosis, right? So this is kind of a seesaw back and forth situation. Is too much vomiting will lead to alkalosis, but if I'm in acidosis, I'm going to be trying to move the other direction. So if you're taking a test or you're looking at a patient's symptoms, ask yourself, am I thinking about a cause or a symptom? Is it asking what caused this situation, or what would you see in this patient? For example, your patient has been vomiting for 3 days due to a stomach flu. What acid-base imbalance would you expect as a result? Okay, well, that much vomit means a loss of acids, and chances are I'm going to see them in alkalosis. However, how about this one? Your patient presents with altered level of consciousness and vomiting. What acid-base imbalance could be causing their symptoms? Okay, well, I vomit to get rid of acids, right? So I probably have a metabolic acidosis. So just use your critical thinking skills to kind of figure out, which direction you're coming from. Okay, so again, the signs of the cause are going to be the first thing you see. Signs of the alkalosis, and then signs of the hypokalemia. So signs of the alkalosis in this case, again, altered level of consciousness. Remember, your brain is very sensitive to pH changes. Headache, numbness and tingling. You'll notice the numbness and tingling is associated with alkalosis, both respiratory and metabolic. And then a decreased respiratory rate. Why? Because if I can decrease my respiratory rate, I can hang on to CO2, CO2 is an acid, and that will help me bring my pH back down. And then again, signs of hypokalemia, things like arrhythmias, muscle weakness, and EKG changes. So our number one priority when treating metabolic alkalosis is going to be fix the cause. This might mean addressing the loss of fluids from all the vomiting or administering potassium supplements, but also administering IV sodium chloride, aka normal saline, is actually highly indicated for metabolic alkalosis because the chloride will help to correct the pH levels. And of course, we can always do dialysis to address any issues brought on by the kidneys and to kind of force correction of that acid-base imbalance. Priority nursing concepts for a patient with metabolic alkalosis are going to be acid-base imbalance and gas exchange. Remember gas exchange because the CO2 and the oxygen, that CO2 balance makes a big difference in our acid-base balance, even in a metabolic situation, because these clients are trying to compensate. So let's recap. Lab values associated with metabolic alkalosis are going to be a high pH and a high bicarb level, as well as a high positive base excess. Causes of metabolic alkalosis are a loss of acids, as in vomiting or NG tube suctioning, or an increase of alkaline substances like with excessive use of antacids or the kidneys just holding on to too much bicarb. Also, don't forget that hypokalemia and alkalosis are very closely related. You're going to see symptoms of the underlying cause, symptoms of the alkalosis, and possible signs of hypokalemia. And we always want to treat the cause, but we also recognize that things like IV sodium chloride, potassium supplements, and dialysis can be very helpful for these patients. Okay, so those are the 4 main acid-base imbalances that you need to know. Go back and review them as often as you need to make sure that you understand the difference. And don't forget to check out all the resources attached to this lesson. Now go out and be your best selves today, guys. And as always, happy nursing.